How do bisphosphonates relate to atypical femoral fractures? Imagine a drug that helps strengthen bones but sometimes causes a rare type of break in the thigh bone. That's what happens with bisphosphonates, which are medicines often used to treat osteoporosis. These drugs work by slowing down the cells that break down bone, called osteoclasts. When osteoclast activity is reduced, bones become denser and less likely to fracture from typical falls or accidents. This makes bisphosphonates very effective at preventing common osteoporotic fractures in the spine, hip, and wrist. However, when people take bisphosphonates for many years, usually beyond 5 years, the suppression of bone turnover can become too strong. Normally, bones constantly repair tiny cracks and microdamage through a natural process of remodeling. But with long-term bisphosphonate use, this repair process slows down significantly. As a result, microdamage can accumulate over time, and bones may become more brittle instead of stronger. This change in bone quality can lead to unusual fractures in the femur, especially in the shaft or just below the hip joint, known as atypical femoral fractures. These atypical fractures often start as small stress fractures that may not cause much pain at first. People might notice a dull ache or thigh or groin pain weeks or even months before the bone actually breaks completely. These fractures tend to happen with minimal or no trauma, and they are often bilateral, meaning they can occur in both thighs. Because of this, doctors usually recommend imaging both femurs if an atypical fracture is suspected. While these fractures are serious, they are very rare compared to the benefits of bisphosphonates in preventing more common and dangerous osteoporotic fractures. The risk of developing an atypical femoral fracture is about 1 in 1,000 patients who have been on bisphosphonates for a long time. Because of this small risk, health guidelines suggest regularly reviewing the need for continued bisphosphonate therapy after 5 years. If a patient shows signs of an atypical fracture or symptoms like persistent thigh pain, stopping the medication is generally advised until further evaluation is done. Treatment of these fractures usually involves surgery to stabilize the bone, especially if the fracture is complete or causing significant pain. For incomplete fractures that are not causing symptoms, doctors might choose to monitor closely. Supporting bone health with adequate calcium and vitamin D is also important during and after treatment. In summary, bisphosphonates help prevent many fractures but can, in rare cases, lead to atypical femoral fractures due to their long-term suppression of bone remodeling. This process can cause microdamage to build up and make bones more prone to unusual breaks. The key is balancing the benefits of these drugs with careful monitoring and timely management if symptoms or signs of a fracture appear. Always consult healthcare professionals for personalized advice and treatment plans, as individual responses to medication can vary.